So an issue with diseases of the urinary system is the funny relationship between the symptoms and the long-term severity of the disease. So to a GP, many symptoms are encountered related to infection, occasionally renal stones, certainly bladder dysfunction. In the modern era, few of these lead to kidney failure. And for a nephrologist, the problem is that the diseases that do that very often have very few symptoms, or if they do, they occur very late on in the disease, so that there's not so much you can do about them having missed the boat. So we're going to talk a little bit about both ends of that spectrum. So the first of the common symptom clusters is those around urinary tract infection, urethritis, cystitis, and when the infection gets into the body of the kidney, a much more systemically severe condition, pyelonephritis, with fever and pain as well. Most of these symptoms, apart from the loin pain that you get in pyelonephritis, are around passing urine. So you pass urine frequency, and it's painful when you do, dysuria. Strangury can be this feeling that you want to pee when there's nothing there, and that can be a symptom of urethritis too. Dipsticks often show a bit of hematuria, proteinuria, and leukocytes can be very useful, or nitrite coming from microorganisms. If you get loin pain, though, that tends to suggest pyelonephritis, though that would usually be associated with fever. Kidney stones cause some characteristic pain. You may also find blood in the urine on a dipstick. The next common cluster is around bladder outflow obstruction, often for short called prostatism, although there are of course other causes of outflow obstruction, but this is the one that's typically affecting middle-aged to older men. And there's difficulty emptying the bladder, and they complain of passing urine frequently, but when they go, there's a long delay before the urinary flow starts, and when it does, the flow is pathetic and slow. It may dribble on at the end, and they may get the sensation of needing to empty their bladder again straight afterwards because there's still some urine left in the bladder, double voiding. Eventually this will lead to retention of urine when the obstruction becomes very severe, and if this occurs acutely, it's typically very painful. You'll know the feeling of having a very full bladder. But when it's been there for a long time and it's chronic, interestingly, those sensations of pain and discomfort tend to go away, and that, for the long-term function of the kidney, is much more worrying. Then there are the less common symptoms around disease within the kidney itself. Nephritis, inflammation of the kidney. Typically, we're talking about glomerulonephritis here, where dipsticks show hematuria and or protein. Blood pressure tends to be high, and in some of these conditions, you may get fluid retention, edema, and of course, renal failure, usually picked up on blood tests rather than symptomatically though. And then there's chronic renal failure, which is when this condition has been there for a long time. So the descriptions around urinary symptoms tend to be around the frequency, whether it occurs at night or during the day, and how urgently you have to go when you get symptoms. Urgency being characteristic of infection again, but also of bladder outflow obstruction. So an interesting thing about nocturia, in addition to people who are peeing a lot or who have infection, you can get it when your bladder loses its normal diurnal rhythm. Actually, it's not the bladder, it's the kidneys. It's the production of urine loses its normal diurnal rhythm. It should normally shut down to give you a peaceful night. But if you have kidney failure or heart failure, one of the early signs can be loss of that diurnal rhythm and needing to go at night. Then there are the different types of incontinence: enuresis at night time, stress incontinence when intra-abdominal pressure is increased, or incontinence associated with brain dysfunction, illustrated at the bottom left there. So we mentioned that bladder outflow obstruction is usually due to prostatic obstruction. That's the most common. When the obstruction becomes chronic, you may get overflow incontinence, and the symptoms are actually just small amounts of urine being passed from an obstructed bladder. But it's important to remember that not all obstruction is associated with sensations like that, particularly if it's caused by neurological injury. So pain is a relatively uncommon symptom. It can be associated with infection affecting the loins around the back, showing here where the kidneys are located. And it can also be associated with kidney stones, in which case it characteristically radiates anteriorly and down towards the testis or labia as the stone moves down the ureter towards the bladder. And renal colic is typically described as one of the most severe pains that you can get, not always as colicky as the textbooks describe, but typically with exacerbations. It may not go away between, and it may grumble on for longer than a colic would typically suggest. When you get pain associated with urination, that characteristically is supposed to be due to involvement of the trigone, this zone here at the base of the bladder between the ureters and the urethra itself. Symptoms of renal failure, as I mentioned, are pretty difficult to pick up. This incredibly useful diagram was produced by a doctor who developed renal failure when he was a student and went on to home hemodialysis in the 1960s, before dialysis was even known to be a viable treatment for long-term survival. He remained on dialysis for over 30 years as a nephrologist, and became something of a mentor to many patients who looked up to him. Here he describes how you know whether your dialysis is adequate. Now, along the bottom is an indication that I've added of the approximate glomerular filtration rates that he's describing in this range. So 0 is associated with death, but interestingly, you only need 15 to 20% of your kidney function to feel really pretty good, particularly if it comes on slowly. So he described that if you were getting adequate dialysis, you would feel active, you would eat well, you'd have no uremic symptoms at all. In fact, many people would find it pretty difficult to spot that this was not a reasonably healthy person, even though actually it's only replacing a fraction of your kidney function. Only a transplant can replace your function properly. Whereas down this end, the characteristic textbook symptoms of renal impairment, you'll notice are really occurring at well below 10% kidney function. So you just don't feel very good. You go off your food a bit. Then the next step is you lose weight and actually start to appear malnourished. And the pericarditis and coma that are described in the textbooks are associated with very low kidney function indeed.